This Spotlight on Employee Benefits is sponsored by Colonial Life, helping you help your business. For more information, please visit www.coloniallife.com. The number of Americans enrolled in employer-sponsored health plans fell 3.7% between 2008 and 2009, according to recent data from the Census Bureau. The figure dipped below 170 million last year after remaining between 175 million and 180 million from 2000 to 2008. Before 2000, the number had not fallen below 170 million since 1997, when 166 million people were enrolled in group plans. Meanwhile, the percentage of U.S. residents covered by private employer-sponsored plans fell to 55.8% last year, from 58.5% in 2008. The share of those enrolled in such plans started at 62.1% when the Census Bureau began tracking detailed health enrollment figures in 1987. The overall drop in enrollment came as the number of Americans with Medicaid coverage increased from 43 million to 48 million. Employer healthcare costs are expected to increase 8.2% as the impact of healthcare reform continues to be evaluated, according to consulting firm Towers Watson & Company, New York. The yearly cost of healthcare for active employees is anticipated to increase an average of $10,730 next year, the study found. The study also noted that senior managers have taken a larger role in researching the best plan, as companies pay special attention to the issue in the wake of unprecedented healthcare reform. Of the 466 large and mid-sized employers surveyed, 86% said they plan to step up efforts that encourage employees' well-being. Additionally, 57% listed compliance with the Patient Protections and Affordable Care Act as their top priority. The first state health insurance exchange following federal health care reform is expected to launch in California once Governor Arnold Schwarzenegger signs the legislation. If signed by the governor, AB 1602 and SB 900 will establish the California Health Benefits Exchange. The exchange will be based on requirements of the Obama administration's health care reform bill and will be managed by an independent commission. The commission will comprise the Secretary of California Health and Human Services and 4 other members appointed by the governor and the legislature. Critics say they worry the commission will fail to establish rules allowing all providers to participate, and that a system will be put in place allowing only a few plans assigned to specific regions. They emphasize a concern that consumers will lack options when choosing their plans. The exchange would not be available to consumers until January 1, 2014, under the provisions of the federal health reform legislation. However, the Commission would form this January to begin the daunting task of implementing the healthcare exchange. Proponents of the exchange hope California will serve as a model for other states as they develop similar programs in response to the federal reform bill. For more industry spotlights, visit producersweb.com.